Navigating Medicare and healthcare in retirement are crucial. Begin by understanding Medicare's parts: hospital insurance, medical insurance, Medicare Advantage, and prescription drug coverage. Each serves different needs. Choosing between Medicare Advantage or Original Medicare with Medigap impacts your financial health. This choice can alleviate unforeseen expenses, aligning with your budget and healthcare requirements. Healthcare costs significantly affect retirement budgets. Factor in Medicare-related out-of-pocket costs, such as premiums, deductibles, and copays. Planning for these expenses ensures healthcare remains a manageable part of your finances in retirement. Consider health savings accounts for tax-advantaged medical expense savings. Also, evaluate long-term care insurance, covering services Medicare does not. It's a critical step for comprehensive coverage. Regularly update your healthcare strategy to match evolving needs. Yearly reviews help adapt your plan, providing continuous coverage without compromising your savings. With informed decisions and strategic planning, you can maintain good health without financial strain. David, what are the most significant challenges retirees face with Medicare and healthcare planning in retirement? Oh, did we lose
David? Let me know. He may have just lost his connection.
Oh, okay. So, he's
there
back.
he is.
I'm back. Sorry, my internet lost. I'm back in. Sorry, what was the question?
The question is, what's the most significant challenge retirees face with medical and healthcare planning?
Yeah, I mean, to me, it's the biggest risk is the idiosyncratic risk around late life medical expenses. I think that when you ask retirees the things they're most afraid of, healthcare costs are usually at the very top of the list. So I think that for most individuals, it's not a material issue. But what we see if you look at the data is there are quite a few older Americans that have significant out-of-pocket expenses that can massively derail a retirement plan. So it's not so much those relatively known fixed healthcare costs, it's the uncertainty of material costs later in retirement.
Wade, are there critical aspects of Medicare that you see retirees often overlooking in their income planning?
Yes, certainly, and especially for people who are still working at age 65, they may not fully recognize what situations allow them to defer the Medicare decision versus when Medicare becomes the primary payer. And if you don't sign up, you may not have a primary insurance in retirement. But beyond that as well, people have to choose between Original Medicare, Medicare Advantage. Original Medicare with a comprehensive supplement is the way to reduce the most risk of large out-of-pocket expenses, especially now with the Inflation Reduction Act lowering out-of-pocket prescription drug costs as well. But most of the marketing and commercials are for Medicare Advantage plans that you see on TV. So sometimes those plans may not provide the full story about what Medicare Advantage provides. And I think people might make a mistake just not in fully being able to recognize and compare the differences between Original Medicare with a comprehensive supplement versus using a Medicare Advantage plan, which doesn't allow the use of supplements.
Emily, how do you address the complexities of Medicare and healthcare planning for retirees?
One of the things I think is important is to think through what the potential downfalls, pitfalls may be. So, there's some that, like, if you know that your family has a history of Alzheimer's disease or cancer or something like that, those are the sorts of things that I'm thinking about. That's the sort of thing that can help you guide your decision when signing up for Medicare and knowing what kind of coverage to go for. And then that also kind of gives you a sense of where to invest your money to best have some set aside in case you have a major medical event that requires a big chunk of money. So because when you take money out of a 401k or IRA, that is going to affect your Social Security benefit because that is deferred taxable. And so the health savings account is one great way to set money aside for medical expenses in retirement. But I also am a big believer in having a robust Roth IRA because that is there in case you do have, heaven forbid, a cancer diagnosis and you need like $30,000 in 1 year just for medical costs or more. If you have it in a Roth IRA, you can access that money without affecting the rest of your budget. And I think that's something that people need to know about. And then the other benefit of it is if you have wonderful health and don't need to worry about it, it's not like the HSA where it is earmarked specifically for medical. Your Roth IRA you can use for other spending if you are lucky enough to be very healthy and not need it for that.
So it makes a case for saving in a Roth IRA before retirement, doing it now.
Yes, definitely.
David, I saw you nodding. Did you have anything to add?
No, I'm a big fan of tax diversification. I think that for most Americans, you're going to experience a lower effective and marginal tax rate in retirement. But given the uncertainty, having Roth money allows you to manage tax brackets. I think I do both. I think even if the math suggests that traditional makes more sense, having some of both is a very smart move for most Americans.
Yeah, I like that tax diversification. Colleen, if good budgeting for healthcare is important in retirement, do you have any tips to help people to prioritize what's important?
I mean, I think the most important thing is really to make sure they're covering the basic costs, right? And then figure out the likelihood of maybe how long they're going to live. And then what costs based on their family history that they're considering most likely to have it. So do they have, cancer in their family? Do they have Alzheimer's in their family? Do they tend to live very long or maybe not as long? So I guess considering their health situation. And then in addition to everything I would also share about ideas of things that they could use is as a backstop having maybe their home or vacation home or rental property. So in the event that they do end up having more expenses than they plan for, having a plan, whether it's maybe help from a family member or selling property, but really knowing that if for some reason they had a large expense, it was more than their portfolio or their Social Security or pension could cover, that they have some way to cover that. They wouldn't want to not have, access to the care that they might need.
Thank you. Let's go to segment 3.